Welcome to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield, where we invite Wellmark experts to discuss healthcare and health insurance topics that matter most. I'm your host, Kareem Amiri. Well, hello, everyone, and welcome to the Health Matters podcast. Today, I'm happy to have Cassandra Hilton, Director of Market Solutions from our product development team, to join me in a conversation about virtual strategies. Thanks for joining me today, Cass.
Absolutely. Yeah, I'm excited to be here.
Yeah, I'm glad you're here. We've worked together for quite a while now.
Yes.
And so to help our audience, if you want to say a little bit about yourself and what you do at Wellmark.
I am the Director of Market Solutions, and my team is really responsible for, taking all the multiple layers and complexity of a health plan product. So working alongside our pharmacy teams, our health services teams, network, and understanding how we really can bring all of those elements together to ensure that we have a product that meets the market needs. Personally, I've been at Wellmark for 24 years, and in that time, actually, I'm at 50% now. Of 50% I spent in sales and had an opportunity to work closely with clients, with groups, with our individual members. And I leapt at the opportunity when I was able to take a chance in taking that passion for meeting our members' needs and applying it in the products and services that we offer to our clients.
Awesome. So, since we're talking about virtual strategies and that facet of your position and what you're looking for our clients, I want to start the conversation with the ongoing issue of accessing quality healthcare. The challenges that go into long wait times. You think about behavioral health and mental health professionals, not maybe being enough in rural areas and that sort of thing. Would you want to elaborate on that and what you see in your work and how you're trying to solve for that?
So what we're seeing in wait times in Iowa and South Dakota may be just a little bit less than what we're seeing nationally, but we are also in a rural access to states, right? So really, though, what we're hearing is there's long wait times of up to 21 days just to see a primary care provider. And when you think about that as an employer group or even as a member, a delay in care never pans out well. Also, by 2033, they're saying that 55,000 more primary care providers are likely to exit. And so when you think about that 21-day average we just talked about is only going to grow. And so as we think about our overall virtual care strategy, obviously access is a big contributor to why we're trying to solve for this issue. Behavioral health is definitely a place that we continue to see a lot of the virtual care used. And so how do we make sure that we're offering the right benefits to the members and making sure that we're helping secure that care that they need in a much shorter time frame than what is happening at this point in time?
Yeah, and I know we're talking about the access portion of it too, but from when you think about for a group and the cost, is that also part of the consideration too?
Absolutely. We are definitely considering the overall cost, and that's where some of our work that we're doing is understanding how we partner in an efficient way that we can make sure that we have quality providers, but that we're also ensuring that we have the cost of care. Like we're in alignment with the rest of our
total
network.
Cost of care conversation, right?
Yep. So the local providers, we're wanting to make sure that this isn't a totally separate solution. Virtual care, that it really aligns and is complementary to the care that we see in office settings. Yeah. And so making sure that the providers are in alignment in payment as well as in alignment of the quality that we expect of our local providers. That's exactly what we're trying to do in virtual care. Not create a separate thing, but really think of it as a place of service.
Yeah, and you talk about our local providers, with the pandemic, virtual care and telehealth, was one of the positives that came out of there. And I think a lot of local providers turned to, I know they went to utilizing virtual care and that really helped break down some barriers to accessing also mental health care. Yeah,
I would say the pandemic was definitely a catalyst to the opportunities for virtual care. I think prior to the pandemic, we saw there was some buy-in, local providers. They may have dabbled in it a little bit, but as the pandemic really kind of forced all of us to think more around virtual care, that gave us an opportunity to expand. When I think about the solutions that Wellmark is trying to provide to our clients and where we're going with virtual care, 3 objectives. We want to make sure that, 1, we have our access for members and how they want to access care. It's really important if there's a place of service that a member wants to access due to maybe time or restrictions, that they have that ability to access that care virtually. But we also want to ensure that that care is appropriately is in a clinically appropriate way, as well as making sure that they have access to high quality providers. So we're trying to make sure that in our overall approach that we are hitting on all 3 of those aspects for care.
So a member can feel comfortable if they have insurance through Wellmark, when they're accessing one of these, that we've already done proof of of their credibility and are going to be a quality provider for them.
I mean, I think I mentioned it a little bit earlier. We want to make sure that we're holding these virtual care providers to the same standard of care. And a lot of those virtual care providers are also our local providers. So it's just, again, a way or a point of access for the members.
Awesome. I know in conversations with employers and, also within the walls here at Wellmark, the terms telehealth and virtual health, they're used interchangeably. And I know we were just talking about it a little bit earlier, but do you want to weigh in on that as well? And are the definitions both the same, or where are there differences?
I would agree with all the confusion out in the market of what's telehealth, what's virtual care, what's the difference. I'd say for the most part, they're probably interchangeable. If you do a Google search, you'll find that everybody defines it differently. And so from a Wellmark perspective, I'd say most of the time what we look at is virtual care as a big umbrella, and that there are multiple ways of access of care in that virtual care where we have, you can use remote monitoring, could fall into virtual care. It could come to telehealth is what we're talking about. But it could tie back into the way you access a provider on your iPad, the way you access a provider on your iPhone.
So chat functionality.
Absolutely. We have some of those solutions as well, right? How can I use my phone and maybe not do a face-to-face on phone, but chat with a coach? And so there's multiple ways that we look at virtual care, but our big umbrella is really virtual care, and then just the different devices and ways of access of care that they can use.
And I know also talking with employers, we're asked a lot about what's the best way or best practices for education and awareness and rolling out these different solutions, from point solutions to like other vendor solutions. We have doctors on demand.
Yep.
What's the best practice to make sure that employees are aware of all the tools that they have at their fingertips?
So this is my favorite question. I love this question because as a market solutions person or a product person, it's important because a solution's created to solve a problem. But if you don't get engagement, it may never solve the problem, right? And so I don't know if anybody's ever cracked the code on full engagement, which when they do, I hope they give me a call because I'd love to pick their brain. What I think about, though, is there's opportunities. A lot of times it's just creating awareness. So thinking about your own employer portal and how you can place it in a prominent place or in a prominent area of your employer portal so that they know that that's an option.
So like your homepage for your own company or your own intranet.
Absolutely.
If you have that.
Exactly. If you have that. But if you don't, there's also opportunities with employer-led communications. I also would say one thing that we've heard loud and clear from our partner in Included Health, but also for local providers, is thinking about how do I download the app or register for my local provider's portal? Because the last thing you want to do when you don't feel good is go through entering in all that information for the first time, downloading the app, entering in your health insurance information, your name, your contact information. So how can you be forward thinking and get that on your phone prior to? Or again, create a registration for your local provider to make sure that when you go into their portal that you're able to quickly access it and it's not a barrier to whether you want to seek care that way or not.
That engagement aspect, how do you get people to do that? So
we actually have had a lot of conversations recently with employers of, one is just a call to action to download the app on your personal benefits site. The other would be reward systems, right? I know a lot of employers use well-being type of points or reward systems, and I'm hearing more and more that just being able to prove that you have the app downloaded or that you have the information entered in, you've registered for your local provider portal, people are starting to reward points on that. And everybody likes something that earns points, correct?
Yes.
The other thing, that we've seen in best practices is just highlighting the services when you're in your employee open enrollment period.
Yeah.
So I think a lot of employers still hold open enrollment sessions. And so having conversations about some of the unique benefits that come with that or the ways that they can access care. I know a lot of employer groups even offer this type of care at $0. And so everybody, again, likes the ability to access care without having to pay a copay or a deductible or coinsurance. And so this is another opportunity to highlight. So if you're an employer group who maybe is just introducing a $0 copay, it's a great opportunity to put that out in the open enrollment sessions. And then testimonials.
Is there any strategy around using the $0 copay for virtual care?
We have the opportunity, we have the ability to offer $0. We have a lot of groups who do it, and there's nothing I would say magical about it other than it's $0, right? People, if you can offer care for free, people have a tendency to at least give it a try because it's one less barrier that they're up against. Cost shares are always a potential barrier, and that's one less barrier and one opportunity that you've offered to your employees. Honestly, also in that open enrollment, you have the ability to do testimonials. And testimonials are powerful, especially because not only does it provide that peace of mind that it's a positive experience, but then it also provides examples of ways to access the care. Because sometimes people, I think the other barrier that members have is they're not quite sure how to use it. They know it's out there. They're not sure what the experience is like. Right. And once they have an opportunity to understand that experience and go, oh, I just had that happen to me yesterday or, 2 weeks ago with my child, and all I had to do was sit them up against, up to the counter, put an iPad in front of them and have a chat, and I could have the medication 2 hours from now and get us on our way. Just having those examples.
Not waiting in the waiting room.
Right. Those examples of how others have used it, I think is always a positive way for people to relate.
Any other best practices?
Oh, timing. Timing
Yes.
on your campaigns is definitely critical as well. So as you're thinking about how you're pushing, so if a great example is if you're really focused on mental health campaign and you have this opportunity to really promote virtual care as an opportunity and as an access point, making sure you understand, is it the right time to promote this? So I always like to use the example of teachers are happiest, right, at the end of the school year when they're getting ready to go into the summer. And so do you want to talk to them about mental health in the summer or as the school year picks up again and just making sure that they understand, hey, don't forget you have resources. As the school year kicks off, we know stress will start to set in, possibly. And so don't forget the resources that you have at your fingertips.
Awesome. So before we end today, I just want to ask one last question. When you think about the roadmap for virtual strategies at Wellmark, where do you see that the next 1 to 2 years down the road? Is there new vendors? Is there, how does that all play?
You should know that answer.
I know, but I'm asking for our audience.
you know that there are a lot of vendors obviously out in the space, and it's an opportunity for us. Back to our 3 core strategies or objectives is, yes, we want to make sure that members have access to care and that they can access it the way that they want to, but we also want to ensure that the quality and the clinically appropriateness is there. So I absolutely think that there's opportunities for us to continue to dig into the different vendors that are in the market. It's just understanding how they fit into the overall scope of the care that we're trying to make sure our members have access to, because again, we know that virtual care will never be a complete replacement for the local providers or for a local office visit. So thinking about how do we take that next step to make sure that there's that coordination between the local providers and a virtual care. So there's a lot of opportunities of how do we bring together that care and making sure that both parties know what's going on with the member holistically.
It goes back to that, creating that confidence for our members that, when they choose that strategy or choose that way of accessing care, that
Yep.
they can feel confident.
Absolutely.
Well, Cass, thank you so much. We are out of time, and I want to thank you again for joining today. And for the audience, if they have any questions or would like to discuss virtual solutions for your specific group needs, please reach out to your Wellmark account manager.
All right. Thank you.
Thanks, Cass. So if you want to continue the conversation about today's topic, please reach out to your Wellmark representative. And thank you for tuning in to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield. Take care.